Welcome back to Vital Signs. If you're just tuning in, you're going to want to go to nowmedia.tv, click on shows, pull down Vital Signs, and catch the first segment of today's amazing episode. It's been pure gold and always beneficial to your overall health and well being. We are here with Dr. Yassir Sonbol. He is a cardiologist, and we've met with him before. I want to welcome you back because I really like to hear more about stress and how that impacts the heart. Welcome back.
Thank you for having me back. It's good to be here.
So we all deal with stress, but and most of us know that sometimes it has some sort of a health impact. We usually see it with our gut before anything else, but it's quietly damaging our heart. How exactly does chronic stress impact our heart?
Well, I'm not aware of a direct correlation, but what I can tell you is stress obviously releases endorphins, right? Or hormones in your body. So when you're stressed out, you're kind of in this what we call this fight or flight response, meaning your body is ready to kind of go on the attack when you're in stress. And so those hormones or those what we call catecholamines in medicine, which are kind of they're what we call they drive, your heart rate up, your blood pressure up, all those kind of things can definitely lead to, dysfunction of organs if you're constantly overstimulated or you're constantly stressed, or if you've ever heard of this thing called broken heart syndrome. Broken heart syndrome is when people develop heart failure, actually, and it's usually in response to some tragic event that happens. So they hear of a family death, they get into a car accident. All those kind of things can actually release these hormones or these catecholamines that we call them, and lead to a surge to the heart, and it causes heart dysfunction. Luckily, most of those people recover from that, but I think stress is definitely very important to mitigate for people, and I think it's important for them to find outlets to release their stress. We talked about, if you want to talk about things that, to release stress, obviously one of the best things to release stress is obviously exercise. And even I challenge anybody to have a stressful day and go for just a 30-minute walk and tell me they don't feel better at the end of that. So stress is definitely important. Stress is definitely a big factor in our health. It can drive our blood pressure up. It can drive, our sugars. It can do all sorts of things. And so it's definitely important to try to regulate that as much as possible.
Heard you challenge our audience already. If you are feeling stressed today, what is your action step? Get out and take a 30-minute walk. And the challenge is see if you don't feel better. I couldn't agree more. Exercise is a great way to bring down stress. There's a lot of different things that we've talked about on the show before to bring down stress. But I want to just highlight something that you said for the audience. And that's one of the things that happens in stress. It's a fight or flight. Your blood pressure goes up. It can cause issues. So I wanted to ask you, are there any warning signs that we would feel? Like, how would we feel if stress is impacting our heart health? If our blood pressure is elevated, if we're having some other things, like what would we be experiencing for those who are watching?
Sure. So some of the things people may experience, for example, would be, just feeling their heart rate fast and their heart is beating really fast. That can definitely be a sign of stress. You can have a big surge in your blood pressure, and that big surge in your blood pressure, you could feel flushed, you could feel lightheaded, you could feel dizzy, you could get a headache. Those are all signs. Other signs, for example, like we talked about earlier, this whole surge that causes heart failure. A lot of times, those people actually are having chest pain and chest discomfort when it happens. And they present to the emergency room, and people think they're actually having a heart attack because their EKG ends up looking like they're having an acute heart attack. And we end up taking them to the cath lab to make sure they don't have a blockage we can fix. And then we discover that, they have this broken heart syndrome just based on the ultrasound later. So there's a lot of symptoms that stress can cause that can mimic actual heart disease. And so, stress can also cause people to have panic attacks, and panic attacks can mimic heart symptoms. They get chest pain, they get chest discomfort, they feel flushed, they feel nauseous, they feel short of breath, they feel sweaty, all signs of heart disease. And a lot of times people seek medical attention for it.
So I heard you earlier. Panic attacks. There's a lot of things that we have heard. They're kind of buzzwords, and we know that those are signs and symptoms. Thank you so much for going into detail. If you're feeling flushed, if you're feeling lightheaded, any of those things are an indication that you
Mhm.
definitely have something going on. It's a time for you to reach out to your practitioner. But a lot of people feel overwhelmed with stress. And one of the things that I've gotten feedback on before, because we've had people on, and sometimes they'll talk about exercise or they'll talk about different techniques, but they feel overwhelmed with stress and in the moment can't figure out how to bring that down. You already shared get out and walk for 30 minutes. What are there any other things? What happens if this is at work and I can't get out and walk for 30 minutes? Do you have any other things that people can do that could maybe help reduce stress that you've recommended to your patients?
Sure. I mean, I can do my best. So I can tell you just personally what I would do. So, I believe that the human is actually divided into three things: mental, spiritual, and physical connection. And so those three things together make people who they are and make them whole. And so when we're under stress, you got to find some way to kind of mitigate that stress by using one of those elements to kind of calm yourself down. So I'm a spiritual person by nature, and so my spirituality is important to me. And so sometimes when I'm stressed, the first thing I do is I just sit down, I close my eyes, and I pray. And I just kind of pray for, this stress to pass, and I pray for some calmness and some peace. Maybe that will work, maybe that won't work at the time. um Other things you can do is just meditate. I mean, just kind of close your eyes, take a 5-minute break. They always say when you're upset or you're angry, you should always pause 10 seconds before you say anything, because the first 10 seconds when you're angry is actually the emotional response. The next 10 seconds is actually the mental response. And so sometimes just pausing for a second, taking a break, allows you to process what you're feeling and determine whether or not you should be as stressed about it as you are and what your response to that should be. Um, so those are kind of personal things that I do that I find to be really helpful for myself.
It's really fantastic. I agree. I actually use the pause quite a bit myself because the other aspect of that is when we're stressed, we come across as curt or whatnot in that response. So it's always a good idea. And when we're dealing with relationships or other people, especially that we take that pause. I like the idea of taking that pause, taking a couple of deep breaths to kind of process that emotion so that we can reduce that stress. So if people are stressed and they're chronically stressed, and they're having challenges managing this and they're continually experiencing symptoms with it, they're flushed, they're feeling that headache or whatnot, is that a cue for them to go to their primary doctor? Is that something that's a little bit more emergent?
I think it depends on how bad they're feeling. So, I mean, I think if I never tell people that never to seek medical attention. So, if somebody's having symptoms that are concerning to them, and let's just say it's on a weekend or their primary care doctor is not available, or then they should obviously seek attention by going to an emergency room or an urgent care to kind of get initial medical attention, let somebody determine how serious this is and whether or not they need further attention, whether it's to be hospitalized or whether they can seek outpatient medical care. And so I always tell people that it's important to just make sure that they, seek the medical attention. Now, I can't say, um, I can't say, what symptoms they should seek it for, other than if it's concerning enough for them. Obviously, things like chest pain, feeling short of breath, feeling flushed, and then, obviously discussing with their primary care or whoever at the time what would be a alternative to, if there's a medication they may need. Perhaps some of these people that are having a lot of stress could have depression and anxiety and other issues that are making stress overwhelming for them and maybe need medical attention for that.
I think that's really sage advice. And remember, folks, this is not medical advice. This is just for your educational purpose only. But the key fact is that if you're feeling symptoms and you're concerned about it, go to get help, seek medical advice, because that will help ease your mind. Because we all know what happens in our mind when we're stressed. We feel something, then we focus on it, and if we don't figure out whether it's something to be concerned about or not, we're just going to stress about it more. So let's break that loop in whatever way we can. Seek out your practitioner and make sure that you are taking care of yourself. So you've already given us several opportunities to mitigate our stress. You talked about the 30-minute walk. You talked about pressing pause, breathing through, and you talked about the spiritual side, prayer or meditation to sort of reduce stress depending on how we are. Those were all very valuable. How can people reach out to you if they would like to learn more about this, or maybe they are seeking a cardiologist and don't really have that practitioner on hand and are looking for that? How can they reach you?
Sure, they can. We're available on the internet, sugarlandcardiologyspecialist.com. You can call our office at 281-912-3866. I'm available on social media, Dr. Yassir Sonbol, on Facebook. I do have a YouTube page as well. So those are all areas that I can be reached at.
Fantastic. Thank you. And if there was any last word of advice that you would like to leave with our audience today, what would it be?
I think, since we're talking about stress, I really think it's important. One of the things that we try to do is we try to control everything. And the reality is, as humans, we should realize there's so little that we control. And I think that's really what's helped me with my stress, right? I finally realized I just have to focus on what I can control and leave the things I can't control to play themselves out. So I think that's a really important message for people moving forward. Just focus on what you can control. So I realize I can control how much I sleep for the most part, or what I eat, or when I get exercise, or you know what I do with my children, etc. But there are other factors in life I just can't control, and I just have to expect that unexpected things are going to happen from time to time.
I think that's the best advice I've heard all day. Thank you so much for sharing that. You're absolutely right. Focus on what we can control, let go of the rest. And something really funny that I shared with another guest, I believe it was last week, is we always think about the worst case scenario and stress about that. And it's always outside of our control. And it almost never, the worst case scenario never comes to pass because we're still here breathing, which is something to be grateful for. So thank you so much for those words of advice. Really appreciate your expertise being on here today. Thank you.
Thank you for having me.
We are going to be right back with a little shifting gear after these messages.